This is Dr. Ankit, and in this video I will tell you about 5 foods that you should avoid if you have fatty liver. If you have been diagnosed with fatty liver, it is important to make dietary changes to support your liver health and reduce further fat accumulation. And here are some foods that you should generally avoid or limit if you have fatty liver. First is alcohol. Alcohol is a major contributor to fatty liver disease, and it can cause inflammation and damage to liver cells, leading to fat accumulation. Drinking a large amount of alcohol, even for just a few days, can lead to a buildup of fats in the liver, which is called alcoholic fatty liver disease and is the first stage of alcohol-related liver disease, or you can say ARLD. If you have fatty liver disease, the damage may be reversed if you abstain from alcohol for a period of time which could be from months to years. Therefore, it is important to avoid alcohol or drink in moderation if you have fatty liver disease. Second are added sugars. Foods and beverages with added sugars provide excess calories without providing any nutritional value. They can contribute to weight gain, insulin resistance, and fatty liver. Fructose is a common type of sugar, and its overconsumption may result in insulin resistance, oxidative stress, inflammation, elevated uric acid levels, increased blood pressure, and increased triglyceride concentration in your blood and liver. Large amounts of added sugar in the form of fructose overload the liver, leading to non-alcoholic fatty liver disease, that is NAFLD. This is a condition which is characterized by excessive fat buildup in the liver. One major source of fructose is high fructose corn syrup, and this is used to sweeten soda, candy, baked goods, cereals, and more. Therefore, it is recommended to stay away from sugary foods if you have fatty liver disease. Third are fried or salty food. Too much of fried or salty food is likely to increase calorie intake, and it can lead to a person developing obesity, which is a common cause of fatty liver disease. Excessive sodium intake can contribute to fluid retention and increase the risk of liver damage. So limit your consumption of processed meats, that is bacon, deli meats, canned soups, pre-packed meals, and salty snacks. Read food labels and choose low sodium alternatives, or prepare meals at home using fresh ingredients, herbs, and spices for flavor. Fourth are saturated and trans fats. These type of fats can increase the level of harmful cholesterol in your blood and promote inflammation in the liver. So avoid or limit foods which are high in saturated fats, such as fatty cut of meat, poultry with the skin, high fat dairy products like whole milk, cheese and butter, and palm oil. Trans fats are commonly found in fried foods, commercially baked goods like cakes, cookies, and pastries, snack foods like chips and crackers, and some margarines. So check food labels for partially hydrogenated oils as an indication for trans fats. Coconut oil also contains saturated fats and was earlier thought to be harmful for health, but recent studies have shown that these saturated fats are of short chain and are good for health. These saturated fats are rich in phytonutrients and polyphenols, and in a study done on animals, the coconut oil has shown to reverse the fatty liver. The fifth and the last food that we should avoid are processed and packaged foods. These foods are often high in unhealthy fats, added sugar, sodium, and artificial additives. They can contribute to weight gain, insulin resistance, and liver inflammation. So the examples include processed meat like sausages and hot dogs, packaged snacks like chips, crackers, and frozen meals and fast food. So these are the few foods that we should avoid or limit their consumption if a person has fatty liver. I hope this video was helpful.